So, unless you have been living under a rock, you have seen that abortion has been everywhere in the news. It's on social media, it's in the news. You cannot get away from it, you can't escape it. It's on signs in people's yards with the upcoming election season. This is what Kamala Harris is running on. She is running on abortion. If you want to ask her about the economy or the border or anything along those lines, who cares? Abortion, reproductive rights. My body, my choice. That's what she shifts into when she's talking about it. So it's everywhere. Welcome back to Speak Out with Christine Jurgen. Today we are going to be talking about abortion too, but we're going to be debunking Kamala Harris and Tim Walz and a lot of these situations that you've been seeing in the media lately. I figured who better to have on than somebody who has committed abortions. And I know that sounds crazy. You're probably like, what? Why would you even talk to somebody like that? Well, this is somebody who had a change of heart after doing abortions and came to realize that this is actually life that we should be cherishing and valuing. We have Dr. John Bruchalski coming on the episode today. And after receiving his medical degree in 1987, he returned to Virginia for his residency in obstetrics and gynecology at the Eastern Virginia Medical Center and the Jones Institute of Reproductive Medicine in Norfolk. There, he practiced the full range of reproductive medicine and performed abortions. As he gained wisdom and experience, Bruchalski came to recognize he was caring for two patients, mother and baby. Bruchalski later established a pro-life OBGYN practice of his own, including caring for low-income and uninsured women. He's the author of the book Two Patients and has now been practicing OBGYN for nearly 40 years. His expertise is unmatched and his testimony is powerful, and I'm so glad we get to learn from him today. Dr. John Bruchalski, thank you so much for joining us today on Speak Out. I am completely honored to talk to you, and I have a ton of questions that I want to get to. But before we do, thank you for joining.
Oh, Christine, to be on this program, been looking forward to it. And it's just wonderful, the information that you're able to get out to so many.
Yeah, so let's do kind of a blast from the past. You have said before that you have memories of when Roe became the law of the land. Can you tell me what your memory is there?
Sure. I mean, I grew up in an incredibly faithful, religious Catholic home. And my dad was a school teacher. He took buses of boys from the prep school to the March for Life. One January, I think it was a Monday, I was shooting baskets out front, and he drives in with his Volkswagen after school. I'm in 7th or 8th grade. And he says, "Oh, Johnny, it's Black Monday. The Supreme Court has legalized the destruction of children in the wombs of their mother." Now, once again, we said the rosary in our Catholic family every morning for the conversion of Russia, being good Polish people. And the fruit of the womb is part of Luke and part of the rosary. I understood what fruit of the womb was even back then. And I just kept shooting baskets going, what? That's crazy. That was my first memory of the issue of abortion being legalized in the Roe v. Wade decision.
That's incredible that you remember that.
Oh.
Even as a child, I mean, a lot of us don't have memories from 6. I mean, some of us do, but 6 is really young.
Oh, yeah. I mean, I was probably 12 or 13 at the time. My dad's driving up the driveway. I was in, like I said, I think 7th or 8th grade, but literally he flew out of his Volkswagen before like he even had it in park and the emergency brake on because he wanted to get it off his chest. He taught constitutional government. He taught what this country was founded on.
Yeah.
And this was like the antithesis. What do you mean we don't care for the least?
Yeah.
So that's how I first heard about it. And it really left a lasting impression. And eventually my dad would teach me how to drive in that car. And I think that had something to do with it.
So then fast forward a little bit, you're deciding what to do with your life.
Yeah.
Medicine comes to mind. How did you decide that you wanted to be a doctor?
Oh, Christine. So the folks in my neighborhood, many of them were female neighbors, and I had a knack for listening. I was the oldest of 3 boys, And most of my friends were women. And I'm convinced that I became a really good, solid gynecologist, even though I'm a white male, because I listened to women like you. And back in the 70s and 80s, most of those women were part of the sexual revolution, the feminist liberation. So what happened was that not only did my educational background, the high school and grammar school and college, one degree by one degree by one degree, they moved me off my parents' position to what was going on in the world. Now, on a religious end, you could say I became a woman pleaser, man pleaser, rather than a mansplainer because of listening to my friends. But I stopped becoming a God-fearer because I began to water down the message. Well, it was right for me, but I can't say it was right for you. I respect your background. Well, I do respect you. And so one degree by one degree ended me up in the second year of my residency in OBGYN doing dismemberment abortions. Because you move from one place to another, the water boils slowly, and like Wormwood with C.S. Lewis in Screw Tape Letters, you just find yourself slowly. Because if anyone would have ever told me, Christine, that abortion is good back when I was younger, I would never have believed it. And even now, when I talk to you about this in front of your audience, which is many, I'm also post-abortal because I performed them. You know, I have always wondered why only 7 to 17% of OBGYNs do abortions. Well, I know why. It's not for political. It's almost not even for medical reasons. It's actually for human reasons. Surgical abortions are brutal. And that's why the whole industry, I'm not going ahead, but that's why we've gone to medical abortions, because there's less and less and less abortionists, people who do the surgical abortions. And that's how telehealth and chemical abortions have come about so easily, so effortlessly, and now they're the majority. And so, you know, it's very hard to force people to do this. And yet, over time, I learned I could listen to a woman's hormonal issues. Bodily autonomy, sure, I'm there with you. You're my patient. I bought that line, moving away from Hippocratic medicine. We didn't take that oath. Equality with men, of course. You can walk away from sexual flings because that's what men do. And you can be just like them. And then lastly, oh yeah, sexual revolution is true liberation. Because remember, by that point in my life, I'm almost a Marxist, going fully against what my folks, as good Polish people, you know, we were under Nazis and then commies fighting for our lives and our country and our soul. Well, I blew that all off. And I can tell you that once you move in that direction, this becomes the backup to contraception. It becomes health. I understand. That's why I don't throw stones at people. I've lived it. I've walked it. I can't throw stones because I've been on both sides.
Yeah.
And so when you listen to women, like folks like your PCOS, polycystic ovarian syndrome, how do you do that? How do you get to the root of it? How do you really listen to me, John? Come on, listen to me. Something's wrong here. What about my thyroid? What about body literacy? Well, I no longer believe that it's something we need to be educating people about their body. We need to collaborate and cooperate with it rather than look at children as sexually transmitted diseases that need to be prevented and exterminated. Oh, we also do the same for Downs and the same for not perfect or genetic issues that are possible, not probable. You know, the fear, the shame. And the industry that I work in, the OBGYN, it's constantly now, the definitions are changing. We now, you know, abortion is now considered excellent health care. And it's all part of that plan to buy into this narrative that was forced on us from the top down. And yet my patients are the ones that taught me why they should have aborted. And then since that time, folks who believe in body literacy, who believe in human flourishing and dignity and caring for the two lives and coming alongside you. So you people, you women, you're the ones that have taught me how to be a good gynecologist. And for the last 34 out of my 40 years of practicing medicine, as a student, a resident, and in private practice, I've been life-affirming now. But those first 6 years, yeah, I did all of it.
So let's talk about those first 6 years. When you went to medical school, most people, I am understanding that this is a gradual change for you, which I think is such an important lesson, because for those of us who are parents, sending our kids to school, even if we have a faith-filled household, we still have to be paying attention to what our children are learning. I homeschool my youngest too, because I gave up on all of that.
Well, we homeschooled too for a few years.
Yeah, I really think that's the answer these days. But so backing up, what was it like when you experienced watching your first abortion, learning about abortion? Because most people don't, I think you'd probably be hard pressed. I'm not saying they don't exist, but somebody saying like, I want to become a doctor because I want to do abortions. I'm sure those people are out there, but they're probably few and far between.
Oh, absolutely. In fact, the Lord, yes.
You're warming up to this idea of abortion in medical school. How did you?
No, I get it. And I appreciate that immensely. It was experiential, Christine. It wasn't intellectual. Yeah, the definition for when life began changed in our Williams textbook in 1973. But that was 13 years before I became a resident. But they changed the definition from fertilization, conception, to implantation. And then it just became, well, whenever the woman or the pregnant person says that life should be protected. But it wasn't intellectual. The first few that I saw and did, it was those early first trimesters where they talk to you about it's just a blob of tissue. Well, it's a blob of tissue after you suction it out and it's in your collection tube. But before that, it has its distinct own DNA. It has its own distinct heartbeat. It has its own, like you can now do 23andMe and Ancestry and see the life of that person or that human being. And we've now fudged all this because really it's not about fertilization. It's about whenever you think consciousness or whenever the woman thinks or the person thinks it's able to be given dignity. Well, we don't, as a scientist, that happened. But when you do the early ones, it's like doing a D&C on a not pregnant woman, except there's lots of tissue. And you only see it in dismemberment.
So you actually see...
Well, you don't... So in those first, like under 10 weeks, when the vast majority occur, just because it's not big enough to look, we kind of dismiss it. Well, no, there's real embryological, scientific, it's a distinct human life. Mm-hmm. However, but once the calcium starts getting into the bones, Christine, 8 to 10 weeks, you have to count body parts, rib cages, skulls, limbs. Because remember, abortion increases at the mortality of the mom increases by almost 40% per week because of bones, because of skulls, because of bigger body parts, sharper bones, more disruption needed. It's the same procedure, but there's no calcified bones early, so it comes out as a blob of tissue, which is really not true at all. But then you have the early second trimester, you have to count body parts. And then remember, you're not just buying into only early abortions. And what we are not really told often is that it's abortion on demand through the entire pregnancy.
Yeah.
And now we're arguing about that politically. Late term, midterm, early. Of course we are. Because and as you get further along and the medications don't expel the tissue from the uterus, the baby, the fetus, you got to reach up inside and crush or remove, dismember, because you can't get it out any other way. And so what happens is the further along, and then when you get to that stage, it's also eugenic abortions. Remember, most abortions done after 20 weeks are not done for the health of the mother or the sickness. It's really done for what the woman needs.
Yeah.
And there are now many eugenic abortions when these fetuses are these young unborn people, these unborn human lives, they're ill. They have illnesses and they're being systematically, the mercy killing, we have to end their life. They're going to be suffering. They're going to cost too much. It's better for the mom and the family. Well, we did those. And that's how we learned on labor and delivery, where you're just aborting. And this is where you get into, the failed abortions, which is a baby born alive.
Yeah. And I want to talk about that.
No, I know. But anyway, this is how you do it.
Totally.
It's little by little. When
you experience watching your first abortions, you're learning on them, they're having you help with it. Did you feel anything inside? Was there anything where you're like, I don't like this is wrong? Or was it just purely medical for you?
No. Christine, good and bad run through the human heart. It's kind of inbuilt in us.
Yeah.
And I wasn't an ideologue, remember. I never did abortions outside of my residency, ever. Didn't need to. Can practice excellent medicine without having to resort to abortions. Mm-hmm. We'll talk about that. But in residency for the first 2 years, I wanted to be the best OBGYN I could be, which means you don't dump the hard stuff on someone else. Meaning, just like I wanted to care for PCOS, polycystic ovary, PMS, menopause, irregular cycles, sexual issues, I also wanted to do these reproductive health rights, provide them, because less and less people were doing it. And so I wasn't a full ideologue. However, I believed that it was good medicine, so I had to steel my heart every time. And in the beginning, you do. But over time, even though you don't have to steel your heart as much externally, take a breath. Realize I'm doing this because it's the least worst option. You're doing it out of default, not because you want to, but you believe that there's a greater good that comes after. Well, in that process, your body keeps the score, as that new book on stress and trauma. Mm. It's ingrained in the human heart. And I found my heart, the schizophrenia. And over time, when you're deciding on caring for a patient based on someone else's value judgment rather than science, all of a sudden you realize it's abortion on demand for any reason, at any time, even after the fetus is born alive. And then you don't want it, the hospital doesn't want it, the mom doesn't want it. So what do? You try to end it. And that's this reality. Just leave it to the doctor and the mother. And what happens is these are live infants that are failed abortions, because only about 40 to 50% of the time do we stop the heartbeat. There is life afterwards, and there are times when we silence or move the live born child to another room just so the mom doesn't suffer even more. So yeah, I'm with you.
So tell me about that then, because we're told that that doesn't happen. There's no such thing as a failed abortion, especially I know your expertise is medical, not political, but with the current political state that we're in, they're saying that there's no babies killed after abortion. How many times did you see a baby that was actually born alive from a failed abortion? And then what do you do to that baby to end the life? Because you're saying you silence them. What do you mean by you silence them?
Well, once again, it happened to me as a resident. You do an early induction in the second trimester for whatever reason, and the child comes out alive and making noise. Sometimes the mother wants to hold it and you give it to her and say, oh, you made the best decision possible. And she's understanding what's happening and she's holding it until it dies. However, in many cases, at that moment, that decision is made. The woman wants nothing to do with that problem. So either I would try to suffocate it with a towel just to keep it quiet so the mom wouldn't suffer more, or we would take the bucket that it was in and move it into a supply room away and let it die on its own. That happens, we talk about there's probably 50,000 at best, because remember, we don't keep score anymore. Nobody's really counting these, and it's very hard to figure out. However, we think that there's about 50,000 just in this country every year. And how many of those are born alive? Hard to know. But I can tell you that it's common practice in the hospitals I've been aware of. You don't often have to call the neonatologist to come resuscitate, because these children are either so early that they can't live outside the womb, or no one really wants them at that time, and the decision is made within that room to complete the abortion, because that's what they were there for. I know. No, listen, this is very hard for myself, but this is the reality. And we're arguing about it like a ping pong ball.
We need to know.
In politics, and we need to know.
Yeah, you're absolutely right. If you go back and think about the abortions that you've done, how many have you done?
Yeah, it's hard to know. I would say both elective and, say, eugenic, probably under 70 total.
Okay. So of those situations, of those abortions, are there any that really stand out to you that were, I don't know another word, kind of haunted you?
Yeah, well, yes.
Can you describe one of those cases?
Sure. Had a patient in our clinic that had one of the genetic tests done, and her risk for anomaly went from 1 in 30,000 down to 1 in 10,000. The risk of a genetic problem. Her boyfriend said, "Oh, sweetheart, this is nothing. 1 in 10,000, that's nothing. Rare. We can keep the pregnancy." The woman, because of fear, said, "No, get it out of me. I can't take that risk." I aborted a perfectly healthy child based on the fear of the mom. Totally unaffected by the condition we were worried about, because we've moved away from. So that was one case. The case that I write about in my book, 2 patients, is that a 23, 24 week, almost over the halfway mark, preterm labor, 2 rooms back to back. One was a different patient with the same diagnosis in one room versus the same diagnosis in the other. In one case, the mom wanted the child, so we did everything humanly possible to care for that unborn life, that pregnancy, and we were able to stop her labor. In the other room, when I walked in, she said, "Get it out of me." But I haven't, just get it out of me. with the same diagnosis, with the same gestational age, I broke water, gave her medicine, and aborted the baby, aborted the pregnancy.
A healthy baby.
Oh, yeah. And the baby was born alive. And I didn't do that great of a history because the woman wanted it out. It's abortion on demand. I did the best I could. But no, I'm good. I can do this. The baby I caught in a bucket. And when I cut the cord, it started to make noise and squeak and cry. So I tried to suffocate it. But I had to tend to her, so I put it down. And when I tried to rearrange the fetus in the bucket, it felt heavy. So I actually had to put it on a scale, because in Virginia, if it's over 500 grams, we had to call the nursery, the neonatal intensive care unit, to come in to resuscitate this new patient. Well, it was 5 grams over 500. And I put it on the scale and I called in the neonatal doctors. And that's when my life changed for various reasons because of the context. It's what I write about in my book, Two Patients. The doctor walked in, took one look what I had done, and says, hey, Dr. Bruchalski, you're better than this. Stop treating my patients as tumors. And by the way, have coffee with me tomorrow. That failed abortion will always be etched in my heart and in my consciousness and in my soul, as well as the pain of that mother who was in a very bad pregnant. I mean, I understand why women choose abortion. The shame. I get pregnant. How could I be so stupid with some guy who doesn't? How could I? Women don't get pregnant because they're an ideologue and say, well, I'm going to have an abortion. I mean, I want the abortion. That's why I got pregnant. No, it's not. The shame, the guilt, the anger, the empowerment, the control, all of this really, and this is what's instilled into us as men and women. It's the least worst option. So you got to have it. It's good backup. And so that child, I believe, lived, believe it or not. And this neonatologist really talked to me about, John, you care for 2 patients as an OB.
This is at coffee? You ended up having coffee with this doctor?
Yes, of course. I mean, this woman was one of the finest neonatologists. So this was a doctor who only takes care of high-risk pregnancies. And she had a change in her heart over the course of her life. And she says, man, you're better than this. You're so good. You make house calls. Your clinic is filled. Patients come to you because you listen to them. You really go out of your way to help their diabetes. And there's another patient. In fact, in the old days, the docs used to take care of 2 patients, OBs. And oh, by the way, you need to get your act together. Now, by this point, Christine, the data's coming in. Abortion and breast cancer, the correlation or the relationship. Abortion and preterm birth, abortion and mental illness. That data was rolling in. And I began to have more people in my life coming up and saying, there's other options besides abortion. I had one and I kind of regret it. In fact, no one told me about X, Y, or Z. And, oh, by the way, you need to kind of get your act together and get yourself right before eternity. And it was in that dynamic that she and a few days later, my mother ganged up on me for totally non-congruent reasons. And I had a change of heart eventually.
And how do you have that sort of reckoning with what you did? And then you're a man of faith, going before the Lord and repenting.
Both this doctor and my mother said, you need to get right with Christ. Because my mother knew. Like I told her outright, I'm doing this for the health of women, Mom. Sorry. And they never stopped praying or interceding for me. So even in your community, whether it's 40 Days for Life or all the older folks who are out there praying for people like me, interceding that I would come to my senses from the slop. Because it was that confluence of factors, data and witness and patience and my own hardness of heart. There had to be a better way. And so my mother took me on a pilgrimage, and it was on that hill that I had that experience. Because remember, I don't go before the Father. I'm the prodigal child. He's waiting for me. Like, he knows me. He knows me better than I know myself. And in that difficulty, in that sin, in that slop, doing, late term abortions, second trimester, third trimester, you realized that you're loved. And it was, I can't explain it. All I know is that he came to me. And I fell down on my face and realized, and that's when I heard, be excellent, practice excellent medicine, see the underserved next to the served, and follow kind of what scripture and tradition has kind of taught us about the dignity of human life. And the science just lines up with all of that. And you begin to see the holistic approach, the psychology, the shame, the guilt, the empowerment, in fact. But the way the world sees it is very, very, I want to say, efficient and very cut and dried, or what they think is cut and dried. That's why after 50 years of Roe, we've had silent no more, and then there were none. People coming out of the industry, patients. And I also think that as we go to more chemical abortions, where women have to visualize what that is in their homes, in their apartments, you're going to find much more trauma. And, I think obviously that's kind of the natural course of what this really is. It's the taking of a life inside the most protected spot, supposedly. And now we're all blurring that language to make it seem that we have to have abortion in order to have great medicine. And the reality there is no. In fact, we found a way at Tepeyac OBGYN and Divine Mercy Care to see we collaborate with pregnancy centers. Send your folks to us, we'll help, to the abortion clinics in the area. If you have a patient who can't go through with it, send them to us, please. We'll work through it. Even the late-term abortionists in Washington, D.C., we'll see those patients if you can't go through with it. We do abortion pill reversal because it's good science. We are able to see the underserved, caring for the less fortunate financially. And then when we have those sick babies inside their moms, we do perinatal hospice. We utilize the womb as a hospice so the mom can spend time with her unborn child, and that child may be so sick that it will die soon after birth. And we don't identify that pregnancy or that child with the disease. We just know it's part of a family. It's a child. It has many other attributes besides whatever illness, life-limiting disease it has. So we use it as a hospice. And there are ways to practice excellent medicine, especially for anybody in the audience who's either on the fence and is worried about all these laws. And can you practice that? Of course you can. People have done it long before Roe. They did it during Roe, and we're now doing it with Dobbs. And so, but once again, you have to twist the definitions, just like they did back in the day of Roe, to kind of get the system to go along with what abortion really is, the taking of a human life. Not just the fetal life, but also the damage done, as that wonderful book, Abortion Solves Nothing and Harms Everything.
Yeah, you have such a powerful testimony that I imagine when you came to the realization that these are lives and we should be caring for both mom and baby, and then you decided you're going to shift course, and then you know, like you said, fall on your face, ask for forgiveness, all of these things, it probably felt like a massive weight was lifted off of you.
Oh yeah, Christine, yes. I can't explain it because I'm still going through it, if you know what I mean. My heart, I can't throw stones at people who have abortions. We tell them in our office, if you have to go, because we give them full consent.
Yeah.
These are your options. These are the risks. These are the benefits. Now, sometimes the pro-abortion, pro-choice, oh no, that's mis and dis and malinformation. Mm. No, it's not. It's full reproductive consent. I mean, it's full informed consent, because we do this with every other aspect of medicine before we do something to a patient.
Yeah.
We give them information.
You're allowed to ask questions. You're allowed to have informed consent. Like, this is one of the only things where they don't want you to have informed consent. And I want to mention that a lot of people who are pro-life will say, well, why would you tell them that abortion is an option? But it's because it is. And if you don't talk to them about it, oftentimes they'll go talk to somebody else about it.
No, absolutely. And what I also want to say to you, Christine, is that when words no longer matter, remember, we've had 50 years, 5 decades of abortion with Roe. We have a culture now infused with abortion. Or, well, oh my God, now they've taken it away from us. That's part of the what's happened is that it happens to patients. It actually happens to providers, practitioners, physicians, pastors, priests, parishioners. This infusion of the abortion mentality has affected all of us. Fear, worry. Well, I'm pro-life, except if it's my child. You know, I'm pro-life now, but I really believe that everybody needs the right to an abortion the first 12 weeks. Yeah. We're seeing more and more of this, and I understand it. However, there's work to be done to kind of communicate, have conversations that are hard. It's experiential. We already know that there's human life. We have ultrasounds. Abortions are still done. Mm-hmm. We're now going to chemical abortions because that's the wave of the future, because less and less doctors do them, and really good nurse practitioners and really good, people who have consciences and who really can't get there, even though they might be wishy-washy. I can't do abortions. I mean, I'll send them to somebody else, but I can't do that. That's the majority. And what happens is that we are right on that cusp where it's experiential, meaning when I give talks to students and I get pushback, whether it's at whatever university I'm at or whatever small group or people, John, I believe abortion is a sacred right. Mm-hmm. I believe abortion is love. I've heard this now multiple times, over 20 years, working for Students for Life, talking for Students for Life at various and sundry locations. Mm-hmm. One is patients say, I have no choice. I had to have the abortion. That's interesting. And it's now experiential because you have your data, I have my data. Abortion just needs to be. Okay, if you think have you done abortions yet? No, but I plan to. Well, most folks who believe they want to perform abortions, once they try it, pass the papaya test. We practice, we do simulations. So you get a papaya and you can scrape out the seeds, and it's kind of a simulation of what an abortion is.
Sounds like a desensitizing as well.
There you go. And guess what? When I challenge these young people, because I have to at this point, remember, nothing else has worked. If you think abortion is loving and you're up for it, go do it. If you're going into OBGYN, we are losing surgical abortion providers. No matter how many good, complex family planning, residency, and fellowships we're trying to get, it's very hard to replace because it's a brutal procedure and it's viscerally disturbing because you kind of know what you're doing, but you're doing it for the greater good. When you tell them to do that, guess what? The vast majority come back and go, can't do it, couldn't do it. Well, I know that because I tried it, and I'm one of those. And we're at a point in time in history that despite the reality that it is a individual human life, different heartbeat, different DNA, has a different 23andMe profile from the mother, the pregnant woman, the pregnant person, we still do it because it has to be done. And we're at a point where the fear is everywhere in media and everywhere in politics. Yeah. And how do you combat that? You combat that with love and honesty and truth. Yep. And you take the pushback, but when you keep doing it, it's that love and care and compassion, that accompaniment, all those things that docs are called to do on both sides of the issue. You know, I know why they want abortion doulas. I know why they want abortion escorts. Because they're trying, you know, once again, I'm not going to judge their character. All I know is that it's a destructive procedure. And in medicine, which is caring for life and health and wholeness, the ending of a life is not healthcare. And it's ultimately, in the short or long term, it may appear good and healthy, but it leaves that emptiness inside. And no matter how much we want to shout our abortions and say, yes, I'm good with it. And even older women in their 60s, no, we have to have it. Why are so many of us on antidepressives and antipsychotics? And why are relationships so broken? I understand the arguments, but the experience is leaving a trail of woundedness on various levels. And I think part of the problem is that medicine has been quiet about it. We kind of look the other way. And, you know, thank God for the American Association of Pro-Life OBGYNs. Thank God for Christian Medical and Dental. Thank God for the Catholic Medical Association. Why? Because we do excellent science. Science does not support abortion.
Right.
And we're at that point where you really do have to challenge people to experience it themselves, because we don't have a whole lot, and you have to do it in love, and then you have to provide care for folks. And it is full informed consent because it's part of the world we live in. Abortion is legal in many places, and it's being enshrined in constitutions. But medicine, no, I can't go there with you. But if you do go and have the abortion, which you can find anywhere on social media these days, come back to us. We'll take care of you. Because once again, remember, these chemical abortion patients are being told not to tell the ER that they even had a chemical abortion, that it's a natural miscarriage. They're told to lie. They're told to keep it secret so your parents don't find out. Shame and guilt continue. Well, no, come back to us. We're not going to push. We're going to check you, make sure that you're not infected or hemorrhaging or stuff left behind. We'll do our utmost. But come back to us, because they will see you at their centers or wherever you go. So no, I think it's good quality medicine, and it's a real answer to the world we're in today.
So you bring up a good point as far as abortions. There's a case in the media right now. I'm sure you've seen it. It's impossible not to see it. A woman named Amber Thurman.
Yes, ma'am.
I wanted to touch on this. So she, for anybody who doesn't know, in this situation, Amber took the abortion pill. Was pregnant.
Pills, plural.
Pill. You correct. She took the pills. She was pregnant with twins. A few days later, she became incredibly ill, went to the emergency room sick, and had sepsis. And they, for whatever reason, apparently treatment was delayed. I don't think we've gotten that information as to why. I don't know how stable she was. Like, that could be part of it. I'm not sure. But so they eventually do treatment for her. Because there's fetal remains left in her. And they have to remove that so she doesn't stay sick. And while they're doing this treatment, she passes on the operating table. So this is the actual case that happened. Can you speak to this from a medical perspective when it comes to the case of Amber Thurman? If somebody comes in with sepsis, how do you treat that?
So on that particular issue, sepsis remember, she was 9 weeks along. That's right on the cusp of calcified bones, as we were talking about earlier. 9 weeks, and it was twins. So the uterus was a little bit enlarged. Gets it done in North Carolina. The first drug, the mifepristone, the RU486, that's what blocks the progesterone receptors to starve that growing fetus from the progesterone. And then a few days later, she's back in Georgia and she takes the second dose of the misoprostol, or the Cytotec, the contraction of the uterus, to treat sepsis, because when she came in, she was already sick, but not deathly sick. She should have received antibiotics and a D&C, dusting and a cleaning, the way my mother told me about it, dilation and curettage. The cervix is probably already open because of the incomplete abortion. Now, there is no heartbeat. So this was a once again, an elective abortion was already done prior to her coming to the ER. Immediately, excellent medicine would say, D&C while she's still stable and the antibiotics. You got to remove the abscess. That uterus is the source of infection. Because as we know from the data that we've been warning people about on the life-affirming side, women use the emergency room hundreds of times more often than people who go through spontaneous losses or after having a baby. Why? Because the uterus doesn't always empty. There was no live birth inside her. So there was no ethical issue. So they're trying to pin, the pro-abortion side is trying to pin, oh, it's because of those damn laws. No, it's because this was a preventable death. And it really was about the side effects of those two medicines. Because remember, every week, it was only approved for 7 weeks. And then each week greater, there's a much higher risk of side effects and problems. And we don't have good follow-up. And all those restrictions and all those oversights that try to make this telemedical abortion safe, all of a sudden are lifted. And we've set ourselves up for cases like this. And so in this case, the medical excellence would have been antibiotics and D&C immediately to decrease the risk of severe sepsis. The longer they waited, they got backed into a corner. And it was really because of medical negligence and the side effects of mifepristone and misoprostol, the chemical abortion.
Yeah.
That's what caused this. And the data that we've been warning folks about on the life-affirming side, it's there. Women, because once again, I know in my patients who suffer miscarriages, Kristen, let's just take this in context. My patients who've had incomplete abortions at home, miscarriages, we didn't kill the baby miscarried, it died on its own. Sometimes the placenta doesn't come always out, and you have to follow up. Well, you do the D&C, you use the antibiotics if that's what happens. In this case, it really was about the medical negligence of that emergency room, as well as the side effects of these two medications. And because we know the data from all the years of study, we're going to see more and more of this. And it's not because of the laws.
Right.
It's because we've had doctors who've practiced medicine with abortion as a backup, and now they're afraid and they think it's legal. No, every state has real, protections about life of the mother in an emergency. So in our case, excellent medicine would say, life-affirming medicine would say, you target it. Now, once again, in this case, there was no fetal heartbeat. The baby wasn't alive, the babies. So therefore, it's not even considered at the point of the Georgia emergency room care. You just care for the patient.
Right. It's no longer really an abortion. It's
no, ma'am. No, ma'am. However, if there was a life there, you never pit mom against her child. It's not good medicine. It's not good psychiatry. And it's not good spirituality. You don't tell her to her face, I have to kill your baby in order to save your life. No, you try to care for two patients like we talk about. But when you're under viability at that early age, you're targeting the infection, the placenta, where the hemorrhage is coming from, and a side effect, an unwanted. We don't want the death of your child or the fetus. We want both of you to make it, but in that case, you have to get out the placenta in order to help the mother out. You do that. And that's the difference, because in an elective abortion, my head and my heart are always, just like I told you about the case I had, the death of the child is paramount. Elective abortion means I desire your child to die. And medicine, OBGYN medicine especially, should never do that. We all know about the legalities of not caring for two patients and how the mom and her unborn fetus and child are so interconnected through the placenta. It's fascinating, fearfully and wonderfully made and all that. That's where human flourishing is about, in that dynamic. And this case is being blown out of proportion on the other side, as if it was the laws that did this.
Right.
No, it wasn't.
So when it comes to the laws in all 50 states, there is an exception for life of the mother. There is an exception.
Yes.
Ectopic pregnancy is not actually an abortion, but you can treat an ectopic pregnancy. They're saying that these don't exist. They're trying to blur the lines. They're trying to gray the area, so much so that women are being manipulated and they're becoming fearful. There's another case, I don't know if you just saw it, that came up in Georgia. A woman, supposedly they're saying it's because of the pro-life laws, but she didn't even seek care. And she had health issues while she was pregnant and she died. And the same organization that came out with the Amber Thurman case, this woman's name was Candy, is saying that this is because of the pro-life laws, but they're not telling the truth that with the pro-life laws. And the Amber Thurman case, again, wasn't even an abortion. The baby had already passed. There's no baby, or there's two babies that had no heartbeat anymore. So it's completely legal to remove what is left. Also, if the babies were alive, like you mentioned, it's also completely legal to remove them if her life was in danger. So this is all fear and manipulation tactics. If they didn't have lies and manipulation, they would have nothing.
Well, I would absolutely agree with you, because when we were taught, like even with genetic cases, you really shouldn't continue to carry this baby. Immediately, if you have asthma, if you have diabetes, if you have heart, you begin to pit, your health might be in jeopardy. And once again, you begin to put blocks, barriers, because when logic and words are fungible, you can disrupt that connection between the pregnant person, the pregnant woman, and her fetus through fear and shame. Because remember, in the sexual revolution, we don't teach body literacy. We teach sex literacy and how to be more what we call satisfied. But in that, the soul ties and the commitment and the real deeper aspects of love, it's not a contact sport. We're not preparing people for this. We think it's normal and you're equal with men, and we go on with our lives. And I'm convinced that the shame and guilt that are there early on in a young woman's life as she's beginning to move away from her parents and finding out who she is, we're just moving that forward. And all of a sudden, if they didn't have this, why would it is what is infecting and being a part of the docs and the patients, whether you're a male or a female or all the other options. I'm telling you, it is shame. And without that fear, the constant, let's blur the distinctions.
Yeah.
There is nothing about, I intend the death of a child. It's not part of good medicine. It's not part of healthcare. That's why abortions have always been done in the shadows. And now, even though my American College of OBGYN really considers it another super specialty, complex family planning, they're forcing it on us from the top down. And I'm telling you, there is a dynamic here that, as states begin to separate, there's a real kind of schizophrenic split that we're seeing that we really have to encourage the care that is needed to overcome the fear and the shame. Because as we know now with trauma, the body keeps the score.
Do you think that, I've had two people reach out to me recently, and I'm curious, with the blurring of the lines, do you think they're trying to blur the lines with miscarriage and abortion? Because people who have miscarriages and have to go in and have things that are maybe the baby doesn't pass fully or there's tissue that's remaining and they have to get it removed, they see spontaneous abortion on their medical record. And I have women who are genuinely like, why does it say abortion? Why does it say that? And there's obviously a difference between spontaneous abortion and elective abortion, but that word abortion.
No. Yes. And they use it absolutely with direct intent to confuse. How many times in our practice do they see after they come to us and we've cared for them fully in a life-affirming manner, it says diagnosis, spontaneous abortion. Abortion is really defined about any early delivery of a fetus before a certain age. There's missed abortion where the baby dies and it's a miscarriage, but it hasn't come out of the woman's body. You're not an on-off switch. It takes time for your body to let go because it's built to hold on to your pregnancy, not to just get rid of it. An incomplete abortion is when there's a miscarriage, the baby's passed, and the placenta and maybe the baby come out, but there's still stuff behind. An elective abortion is the direct intention that I'm going to do something to end the life of the fetus. And that's what Planned Parenthood, that's what the abortion industry is all about, the direct intent. But in order to overcome that, oh no, it's just like a miscarriage. Oh no, it's just like an ectopic. Oh no, we need it for the life of the mother. 1% of all abortions are done in that time before viability. It's very rare. And in those cases, like I said, you always target the underlying disease.
Yeah.
Your intent is never. So no, you're spot on, Christine. So absolutely.
It ends up having women who have had miscarriages advocate for abortion because they think that's what they've had. And that's where some of this gray area is coming from of, a woman saying, but if you tell a woman who has had a miscarriage that you aborted your baby, most often she would be deeply offended. You know, I did not intentionally kill my child. No.
When you do, yes.
Just
Oh, absolutely.
the same.
No, go ahead.
Code. I was just saying, just medically, as far as like code and insurance purposes and the intent to gray the area, they consider it the same on paper, but in reality, it's not.
Oh, no, it's absolutely. But when you become very sensitive to this issue and, you know, you would protect your child. What do you mean no, it was a miscarriage. That's why when you do informed consent, they want to keep the language in their ballywick. They're constantly telling us to change our vocabulary.
They're good at that.
No, it's not I'm sure if you've had children, you heard that heartbeat at 6 weeks. Well, that's no longer a heartbeat. That's just a electrical sound because there's no valves formed. They're literally manipulating the definitions of something that we know experientially. Oh my God, I heard a heartbeat at 6 weeks. That's wonderful. Oh, that's so good to hear. Oh no, it's not real yet. It only happens at 24 weeks or whatever. Wait a second. It's going again. So whatever you see and believe, you really shouldn't believe that because we're the ones trying to control your virtual reality. Because with fear and that deception, the lying, that's how you help spread this.
Yeah.
And my heart goes out to these women who suffered a miscarriage and then think that they need abortion rights because no, it's just good medicine how we can care for both patients, but care for you first because you are you're our patient and your child is our second patient. But by caring for you excellently, your child will also be cared for excellently. And it makes real sense. But no, you have your finger right on the pulse, and I really appreciate Speak Out for that.
Yeah. So, Dr. Bruchalski, do you have a few more minutes, or are you short on time? I want to be.
I have just a few more minutes. Sure. Maybe one more question or something.
Okay. So, I asked the people who listen to the show if they could ask a former abortionist anything. What would they ask? And you can be brief with these answers. You do not have to give me anything. I only pulled 3 of them. There's somebody who says, thank you for being a former abortionist. Where do you see the future of the abortion industry going?
I think they're going to have a very hard time doing the surgical abortions. So I think you're going to see the chemical abortions and the telehealth and the mail-ins. That's going to go up. And then I also think that there's going to be pressure on conscience protections because when you're in a system where you have to force a procedure on the people doing it, that forcing, that coercion continues. And so I think there's going to be less surgical abortionists, more medical abortionists, more trauma of women ending up aborting their pregnancies, their unborn child in their homes, in their apartments, in their hallways, in their bathrooms, in their beds. And that's going to incredibly increase all the mental health issues that is there. I also think we're going to see more and more conscience assaults to try to coerce or punish people who don't provide or refer for abortions. And it's going to be done forcefully because 50 years, they haven't gotten more than 17% of people doing the surgical abortions.
Yeah. Dr. Bruchalski, thank you so much for your time today. It's been a pleasure. I probably could have asked you 50,000 more questions. Thank you for what you do for women. Thank you, like the listener said, for being a former abortionist and being willing to speak out on this issue. I know it's tough. You probably get a lot of pushback, but I think that your firsthand experience can change hearts and minds in the way that, those of us who have not been there can't. I think I can reach a certain number of people and type of person. I think that you're going to be able to reach those that maybe I can't reach because
encourage, just continue to pray and for that. And this has been incredible to be with you for this very short hour and just abundance upon you and your audience, really, truly.
Thank you so much.
Thank you.